And I'll put them now to infectious diseases expert, Associate Professor Sanjaya Senanayake. He joins us in our Canberra studio. Sanjaya, thank you very much for your time.
Oh, thank you for having me.
All right, here we go. Let's start. I've got some great questions. Grant writes, we are told that face masks are not effective to prevent virus spread. All our sporting events, airlines, entertainment live now shut down. Why, if this hazmat measure is not effective, do all health workers wear these? Is there a difference between face masks and how effective are they?
Yeah, look, there are two types of face masks, the so-called surgical masks and then the N95 masks. Now, the surgical mask that you can get quite easily, that doesn't fit particularly well. It's not effective for that long. It can get wet and moist, so wearing it out and about isn't particularly helpful. The best situations for wearing a mask, either a surgical mask or the more fancy mask I talked about, are in two situations. If you're a healthcare worker looking after a patient in hospital with COVID-19, and if you're looking after someone at home with COVID-19. So those short encounters with people. But going out and into the community and walking around with a mask may not be that effective. Hand hygiene's still the best thing to do in that situation.
OK, Claire writes, is it true that some children who contract the virus can experience it so mildly they can go completely unnoticed?
Yes, no, children are the great unknowns so far in this outbreak. So when you looked at the initial data from China, the first 45,000 confirmed cases, only 2%, so this tiny percentage, were children. And then the question was, is it that more children are getting infected, but we're just not picking them up because they're having such mild infections? And it certainly looks like they are having very mild infections, and it may even be they're not getting infected much at all. Okay. So we're trying to do the studies to work that out.
All right, Andrew writes, once you have had COVID-19 and fully recovered, can you get it again, or are you immune?
That's one of the great unknowns. We had a study that came out in Nature magazine by the Doherty Institute, some great work there, where they looked at someone who had a mild infection and monitored their immune response. And they found that various aspects of the immune system were activated, including antibodies, which often gives you long-lasting immunity. And we know with other coronaviruses, we get about 2 or 3 years immunity after an infection, so maybe this is the same, but it's watch this space. OK. Ashley writes, do grandparents have to stay away from grandchildren completely? So again, that relates back to the last question, how easily children get infected. If this was influenza we were talking about, if there was a mutated strain of bird flu, I'd definitely be much more worried because children transmit flu very easily and they're major drivers in the community. But this one, not so much. But grandparents, because they're more susceptible being older, if anyone is unwell, adult or child, they should keep their distance. Gargling vinegar doesn't help, does it, Sanjaya? Look, doesn't help COVID-19, doesn't help your breath. So. Right,
good. Liz writes, can you shed some light on how long the virus lives on a surface, and are there safe surfaces like fabric surfaces?
Look, that's a very good question, and an article just came out in the New England Journal of Medicine looking at that, and they thought on the basis of their laboratory testing it could last maybe about 2 or 3 days on a hard surface. Now, whether it's still viable and able to infect someone is another matter, but it could last in those situations. But depending on heat, humidity, the type of surface, it's hard to know. So fabric, hard to say whether it'll live a little bit longer or a little bit shorter. OK, you're doing very well, by the way. Von says, is the virus killed by heat? I heard that it was killed at a Celsius degree of 56. Is any of that true? Well, certainly coronaviruses can be killed at about 70 degrees, and that issue came up when people were talking about food handling and cooking. It is a thermolabile virus, so at hotter temperatures it tends to break down. but certainly, definitely about 70, not so sure about 56.
OK, Nicole says, should those with an underlying lung condition be isolating if they are in their 40s?
So I think this whole concept of social distancing is trying to keep all of us away from people with COVID-19 and getting easily infected. But yeah, there are certain groups who are particularly vulnerable. Even though that person is in the younger age group, they have got a chronic lung problem. So they should be extra careful. But whether they should be completely isolating themselves, I don't know about that.
Laurie asks, what are the chances of catching the virus from purchasing takeaway food, and how long could it live on the takeaway containers?
Okay. So we were talking about the preparation of food. So at high temperatures, it should be killed like other coronaviruses. If it's on a surface, we are just saying it could last up to a couple of days. That's possible. But given the fact that we're washing our hands before we eat and after we eat using good hand hygiene, that should minimise that sort of risk.
OK. Andrea, very quickly, last one. How much washing and sterilising do you do if you're self-isolating? How much do you do at home?
Right. So if you're self-isolating and you're part of a family, I wouldn't necessarily sterilise more than usual, but it is about self-isolation. So keeping to your own room as much as possible. If you are coming out to mingle with the rest of the family, making sure you have a mask. And then if you're touching common surfaces in the kitchen, etc., making sure they're wiped down. Those sorts of measures, and using your own bathroom if you have that luxury.
You've been brilliant as usual, Sanjaya. Thank you very much for your time this evening.
Oh, it's always a pleasure.
Good on you. Fantastic.